Fox 8 News is New Orleans' most watched late news. Fox 8 Local First starts now.
Covert motives with hidden agendas and an unfair, unlevel playing field.
You wouldn't buy a car without knowing the price, but area hospitals and medical facilities expect you to do that with health care. And we found prices can range thousands of dollars between offices that are just miles apart. Good evening, I'm Lee Zurik.
And I'm Shelley Brown. If you go to the doctor, have been to the hospital or a medical facility, and those trips cost you money, this story matters. It's important to you.
Yeah, tonight, Fox 8 News and our partners in NOLA.com, the Times-Picayune, launch a new investigative series. We're trying to crack the code of healthcare pricing as many of you deal with rising costs of healthcare. These two medical offices may only be a mile and a half apart, but when it comes to the price you pay for services, the cost isn't even close. Without using insurance but paying cash, a lower back MRI at stand-up open MRI centers costs $1,250. Down the road at Metairie Imaging, the same procedure costs about half the price, $675.
It doesn't make any sense at all.
At Thibodeau Regional Medical Center, the cash price for an ultrasound in your abdomen is $971. In nearby Homa at Leonard Chabert Medical Center, the same procedure costs $161.
If you look at it from a system point of view, there's no reason at all. And again, it's as though your Chevrolet costs $25,000 at one dealer and $50,000 at another dealer.
Robert Field teaches at Drexel University in Philadelphia and is nationally regarded as a health expert.
Chest x-rays, artificial joints, heart surgery, you name it. The prices are literally all over the map.
Like this example, in this uptown New Orleans office building, a vasectomy costs $2,500 when patients pay Dr. Ronald Swartz cash. A block away, two doctors, Neil Baum and Thomas Ewing, charge much less, $850 for the same procedure.
Comparison shopping would do a lot to solve that, because if someone charged an outrageous price, you would know just not to use them. But when there's no transparency, it's invisible. So you don't know if you're getting ripped off or if you're getting a good deal.
But right now, most prices are hidden. Few hospitals or offices post them online. And as we found out, getting answers on the phone can be difficult.
It is chaos. It's impossible for anyone to find out how much anything costs. And then people wonder why costs keep spiraling upwards.
Dave DeBroncart had skin and stage 4 kidney cancer. He almost died. Now he has his own website and advocates for price transparency and fairness.
When someone's in a crisis, they don't have the luxury of going out and spending 3 months researching their options the way I did when I had a simple skin cancer. So like they've got you and you're having a heart attack and you're not going to go out shopping for alternatives. And this is where I feel that it verges on being immoral, because you've got somebody by the heart, perhaps literally, and you can just squeeze and get what you want out of them.
Fox 8 News and our partners at NOLA.com, the Times-Picayune, have launched a new investigative project, Cracking the Code, the real cost of health care. Our goal, bring transparency to prices in the metro area. We've partnered with another company, Clear Health Costs, which has spent the past 2 months gathering cash prices for 35 procedures. You can find those prices on our website. But this is where we need you. We want your help gathering prices. We need the cost of any procedure you've had, MRI, colonoscopy, blood test, you name it. We want you to add all of that information into our website to help create a larger data set and help us find stories and help you get information. Here's what we need you to do. For each procedure, you should have or be able to get an explanation of benefits form or an EOB. Pull out that form, log on to fox8live.com/health. You'll find this tool that allows you to enter your information. All of this is private. At the top, enter the type of procedure you had, or what's called the CPT code, the number that goes with the procedure. Here it's 55250 for a vasectomy. Next, put the hospital, medical office, or doctor's office where you had the procedure. You need to let us know if you have insurance, and if so, list your health insurer. Next, put the date of the procedure, enter the total price you were billed, then enter what insurance paid and what it cost you. You can give us your email and phone number. You can even upload your EOB form privately, directly to us.
I think that if people know what's out there, they're more likely to demand something. In a sense, knowledge is power. The less you know, the more you can get hit by a surprise bill.
You can also email us directly at health@fox8live.com or call 504-483-1558. We want to help you discover findings like this. A Fox 8 employee recently went to the hospital for an MRI. The hospital charged $2,600. It cost our employee $1,500. But when we called and asked for the cash price without insurance, we found out he could have saved money. Through insurance, it cost $1,500, but with cash, he would have paid just $900.
To the extent you know, number one, that there's a problem, which is what your series is doing, and number two, how to address it. Maybe you don't have all the tools, but you have some of the tools. I think that's a tremendous service that you're providing. And if enough people do that, the hospitals might start paying attention.
When you buy a car, buy a TV, buy groceries, you know the price, or at least have an idea of the cost before you check out. But in healthcare, many people go in blind. We're asking you to join Fox 8 News and NOLA.com, the Times-Picayune, over the next few months and help us as we try cracking the code of healthcare costs.
Imagine the auto ads in a newspaper or on TV, if they just wouldn't tell you what the prices were. It'd be a very different thing, especially if you then get onto the lot and then they tell you, okay, you just bought this car and we'll send you the bill later. That's how absurd it is.
Jed Lipinski from the Times-Picayune contributed to this report tonight. We reached out to Stand Up Open MRI centers but never heard back. Thibodeau Regional Medical Center told us the price on the phone was an estimate and not a guarantee. We followed up to the hospital with additional questions but haven't heard back yet. To see the Times-Picayune's version of this story, log on to NOLA.com/health. And once again, you can find the information on our website at fox8live.com/health.